Hey guys! So today I wanted to talk about SPD, specifically in pregnancy, because it's what I'm dealing with right now. And it has been such a frustrating thing to deal with, but I have found a lot of things that make it much more manageable. And so I wanted to talk a little bit about what it is and then the things that have really worked for me, for anyone who might be dealing with this as well. So if you don't know already, SPD stands for symphysis pubis dysfunction. And this is a condition that causes excessive movement of the symphysis pubis. So your symphysis pubis is a little joint made of cartilage that comes right at the base of your two pelvic bones. In pregnancy, you have all of that lovely hormone relaxin to really loosen up your ligaments and make it easier for the baby to come out. Symphysis pubis dysfunction is where you have an overproduction of that relaxin, or your joints are already loose and it causes a separation between your two pelvic bones too early. And for me, the pain is really bad when those bones become misaligned or that joint becomes inflamed. I first had symphysis pubis dysfunction with my last pregnancy. So I flew through my first pregnancy, no problems. I did full ballet classes all the way up until the week of her birth, and I never experienced really any pain at all in my pelvis during my first pregnancy. In my second pregnancy, I remember very specifically at 24 weeks getting this pain in my pelvis that brought me to my knees. And I was on the floor of our apartment trying to crawl to my bed and feeling like my pelvis had just fractured. The pain was so bad, and I was sure that I was going to have to spend the rest of my pregnancy bedridden. Luckily, after I got diagnosed with it, I was able to work with my chiropractor and my Pilates instructors to do specific exercises and to really keep working on keeping my pelvis in alignment, and that helped a lot. But the pain was really, really bad. Luckily, it completely cleared up after I gave birth to my daughter, and I didn't have the pain anymore at all. I know some people do experience SPD past the birth of their child, and I know some people don't even experience it until after the birth of their child. So it is a very unique thing, but I was super grateful to not have that pain after the baby came out. But I remember specifically thinking that if that pain was going to happen in any subsequent pregnancies, then I did not want to get pregnant again, because it was so painful and it was so debilitating that it made pregnancy really hard to enjoy. So when we had this little surprise, that was one of the first things that I thought about. And my game plan when I first found out I was pregnant was just to do all of the exercises that I already knew about to really work on strengthening my pelvic floor. However, the first trimester was so rough for me. I was completely laid out, and I really didn't focus on that. So right around 20 weeks this time, a little bit earlier than last time, I started to feel that pain again. But I have tried to be really proactive ever since then in going to the chiropractor and in doing my exercises. There have been some moments in this pregnancy where the pain has been really, really bad, unbearable, where I can't walk and I'm shuffling. But overall, I feel like it's been a lot more manageable this pregnancy than last pregnancy. One of the things that's really frustrating for me is pretty much everything in ballet is contraindicated for SPD. You're not supposed to be standing on one leg. You're not supposed to be raising your legs away from each other or opening them away from each other, which, you know, is just what we do in ballet all of the time. But I've pushed through, not in taking class myself, but in teaching. Right now I'm down to just teaching 1 day a week, but I teach for 4 hours on that day, and I will say every Monday that I teach after my 4-hour shift, I come home and the pain is really bad. And usually the next day on Tuesday, I have a lot of trouble walking. So I'm coming to terms with the fact that I probably need to stop teaching until after the birth of my baby, which makes me really, really sad. But I think this coming week will be my last week, and then I'll take my last 4 weeks of pregnancy off, because I know also as the baby gets bigger, it puts more pressure on your pelvis, and as I get closer to delivery, I'll have even more relaxin flooding all my joints. So preemptively, I just want to try to really maintain as much mobility as I can in walking and doing my day-to-day activities. I think that something that is really important to note is that there are always things that you can do to make the pain better. Because I feel like whenever I've had the pain at its worst, I've almost gone into a depression because I feel like I'm going to be experiencing this level of pain forever, and I'm not going to be able to walk, and I'm not going to be able to do any physical activity, and that's just not true. There are so many different things that you can do to really manage it and work with it. And now everybody's case is different, but I wanted to share with you some of the things that have really been working for me. I'd say my number one tip is to find a really good chiropractor. My chiropractor has been indispensable last pregnancy and this pregnancy. I have been seeing my chiropractor consistently every 2 weeks. I try to make it to every 2 weeks, but eventually I might have to cut it to 1 week because I do notice after about a week then I start to feel the pain a little bit more severely. From when this pain started at 20 weeks to where I am now, which is about 34 weeks, when I've seen the chiropractor, the pain has almost been 100% eradicated. Almost, not quite, but it's so manageable that I can walk freely with no pain. And I'm not hobbling around like I am when my pelvis is out of alignment. I know some people have also had lots of success with a physical therapist. This is not something that I've tried, but I would definitely recommend that as well. It's all about the relationship between your muscles and your bones. So finding somebody who's really skilled in their profession that can help you work on the alignment of your pelvis as well as strengthening your spinal muscles, your tummy muscles, your pelvic floor, your whole pelvic girdle, and your hip muscles, and your lower back muscles. So yeah, just all the muscles around there is so important to really work on strengthening those muscles to support as much as you can. There's a few exercises that I specifically do that I'd be happy to share with you guys if you'd be interested. Let me know in the comments below and I can make another video on my specific SPD exercises that I do. Now, while I am still teaching ballet, which is a no-no, I do avoid things like riding on bikes, trying to go upstairs, anything where you're really shifting your weight and maybe causing your pelvis to go out of alignment. This also includes really simple day-to-day stuff like putting on your pants or getting out of the car or even sitting the way that you sit. So when I first read about the things that you could do for SPD, I was like, come on, I can put on my pants. But I actually noticed, especially the further along in my pregnancy, I feel severe pain the moment that I try to put one leg into my pants. So every morning and every night now, I sit on my bed to put on or to take off my pants. Whenever I'm getting out of the car, I don't bring one leg out and then the other. I keep my legs together and move them as one piece. So you're really just trying to maintain your pelvis and not open it up too much. One of the things that is recommended for SPD is to never sit with your legs crossed, which I can't believe how difficult this is for me, but it's just such an ingrained habit to cross my legs. So it's been a very conscious effort that I've been making to not cross my legs. Ice packs have been indispensable for me. Every Monday after I'm done teaching, I have to have an ice pack right on my groin for at least 20 to 30 minutes before I go to bed. And anytime the pain has been extra severe, when I feel like that joint is inflamed, ice has been really, really helpful for me. I just do about 20 minutes of an ice pack, and I find that that eases the pain some. Now, pregnancy support belts, I've heard lots of people recommend these, and I do have one. I used it a lot in my second pregnancy, and it did help. When it first started to have the pain in this pregnancy, I did start using it, but one night when I was teaching, I had my support belt on when I started to feel the pain. I taught the rest of classes. I came home, sat down, ate dinner, and while I was sitting, I took the support belt off, and when I stood up, I felt like my pelvis was just gonna fall out in pieces on the floor. It was so painful, and the next day I couldn't walk at all. When I talked to my chiropractor about it, he said that having the support belt probably gave me ability past what I should have been using, so I way overdid it, and then when I took the support belt off, everything fell out pretty much. So I've been trying really hard not to use it. This is a personal choice just because I really want to strengthen my own muscles and not rely on the belt. However, sometimes when the pain is really bad, I do use it just for walking and stuff like that. I wouldn't recommend using the belt to exercise, but again, that's a personal decision. Everybody's experience is so different, and I have heard a lot of people say good things about these. I think as I get further along in the pregnancy, I probably will start using the belt a little bit more, especially just for day-to-day activities. But so far, I've been trying to see how far I can get without the belt, so that I can really listen to my body and stop when I'm feeling the pain. I still really appreciate having the belt though, and like I said, I probably will use it more going forward as I reach the end of my pregnancy. So I'll link the one that I have below. It's been pretty great. It was a hand-me-down, and there's many options when it comes to pregnancy support belts out there. So you can just Google it and shop around, find what works best for you. Another huge thing that I have noticed really aggravates my pain is lifting or pushing anything heavy. So I have to be really careful about picking up my children. In fact, I really try not to pick them up whenever I can avoid it. It's been much more difficult with my 2-year-old who wants me to hold her all the time right now, but I try as much as I can not to pick her up and to have her be really independent whenever she can be, so that I don't have to pick her up, because I notice whenever I pick her or anything particularly heavy up, I feel the pain in my pelvis, probably because it's linked to my lower back and all of those other muscles. Also, whenever I push anything heavy, so like a heavy stroller or a heavy shopping cart, I feel pain in my pelvis. So I've been trying to avoid going to the grocery store alone with my kids and just going whenever I have my husband available to me. That doesn't always work, but trying to be really conscientious of where I'm exerting my energy and trying to really protect my pelvis so that I can, like I said, maintain the mobility I have, because I really appreciate walking without pain. And when you've experienced pain in everyday activities like walking, where you have to shuffle around holding your crotch, the moment that you can walk normally without pain is like a miracle. And so I really want to continue to be able to walk without pain. There's a certain level of discomfort that I feel like I've just kind of come to accept and get used to, but I feel like it is so manageable compared to what I experienced in my last pregnancy. So I hope these tips can be helpful for anyone who might be experiencing SPD as well. Like I said, it is a very individual condition. So many people have different reasons for having it, have different time periods of having it, different triggers and stuff like that. But I just wanted to share what has helped for me, because it has made such a huge difference in my day-to-day living. If you have any tips or tricks for SPD or pelvic girdle pain, please leave those in the comments below. I'd love to hear your experience. Thank you guys so much for watching, and